The respiratory system is essential for gas exchange in the body, allowing oxygen to enter the bloodstream and carbon dioxide to be expelled. Here's a comprehensive overview. Nasal cavity air enters through the nostrils and is filtered, warmed and humidified in the nasal cavity, pharynx. This is the throat area where the nasal cavity and mouth meet. It serves as a pathway for air and food. Larynx. Known as the voice box, the larynx houses the vocal cords and is responsible for sound production. It also protects the trachea against food aspiration. Trachea, commonly known as the windpipe, the trachea connects the larynx to the bronchi. It is reinforced with cartilage rings to keep it open. Bronchi. The trachea divides into two primary bronchi, left and right, which enter the lungs and further branch into smaller bronchi and bronchioles. Lungs. The lungs are the primary organs of the respiratory system. They are divided into lobes, 3 in the right lung and 2 in the left lung, and contain alveoli, tiny air sacs where gas exchange occurs. Alveoli. These microscopic sacs are surrounded by capillaries and are the site of oxygen and carbon dioxide exchange. They increase the surface area for efficient gas exchange. Diaphragm, this dome-shaped muscle located beneath the lungs, plays a crucial role in breathing. When it contracts, it creates a vacuum that draws air into the lungs. Gas exchange. Oxygen from inhaled air passes through the alveoli into the bloodstream, while carbon dioxide from the blood is expelled into the alveoli and exhaled. Regulation of blood pH. The respiratory system helps maintain acid-base balance by controlling carbon dioxide levels in the blood. Protection. The respiratory system filters, warms and humidifies incoming air. Mucus traps particles and pathogens, while cilia help move them out of the airways. Sound production. The larynx enables vocalization by modulating airflow and vibrating the vocal cords. Inhalation. The diaphragm contracts and moves downward while the intercostal muscles between the ribs lift the rib cage. This creates negative pressure in the thoracic cavity, allowing air to flow into the lungs. Exhalation. The diaphragm relaxes and the elastic recoil of the lungs pushes air out. This process can be passive or active, depending on the level of physical activity. Asthma. A chronic condition characterized by inflamed airways leading to difficulty in breathing. Chronic obstructive pulmonary disease, or COPD, a progressive disease that obstructs airflow, commonly caused by smoking. Pneumonia, an infection that inflames the air sacs in one or both lungs, which may fill with fluid. Lung cancer, abnormal growth of lung cells, often associated with smoking and environmental factors. Tuberculosis, or TB, a bacterial infection primarily affecting the lungs, characterized by persistent cough and chest pain. The respiratory system is vital for survival, providing the necessary oxygen for cellular respiration and removing carbon dioxide, a waste product of metabolism. Understanding its structure, function, and associated maintaining respiratory health and overall well-being.